There's two types of test anxiety that you deal with in nursing school. Which type do you struggle with? The first one is the stereotypical test anxiety. This is that experience where you go, you sit down for your exam, you studied, maybe you can get the first couple of questions good, but then you hit a question that you are not sure about, and all of a sudden you just go blank. You get a lot of the physical symptoms, like your heart's racing, your palms are sweating. You might even feel that panic feeling rising. Basically, your brain just stops working, and you sort of lose control over it, and you're just no good at all for the rest of the exam. This type of test anxiety is obviously a big problem because your exams are not going to be an accurate reflection of what you actually know. And you're not going to be able to use your critical thinking skills as well on the exam to answer questions either. But that's actually not the most common type of test anxiety that I see in the students who come to me for tutoring help. And I'd even say that for the majority of people who do actually have this first type of test anxiety, it's actually developed secondary to this second type of test anxiety I'm about to tell you about. The second type of test anxiety happens because no matter how hard you study, it just doesn't seem like it translates well to your exams. This leads to a feeling of hopelessness, a loss of control, because no matter how hard you work, no matter how hard you want it, you just can't seem to do well on your exams. This type of test anxiety is really understandable. It sort of becomes like a learned helplessness, and you don't know what to do about it. So you can probably start to see why this type of test anxiety can then go on to become the first type of test anxiety as well. That's why I always take a two-pronged approach to helping students overcome their test anxiety so that they can do much better in nursing school and feel more confident. Quick disclaimer before I tell you what they are. I'm talking about like your kind of run-of-the-mill test anxiety. If you have a clinical anxiety at all, get professional help, use your testing accommodations. There is nothing wrong with it at all, and it can only help you. But the two strategies that I use to help students overcome test anxiety in nursing school are this. First off, we take care of that immediate anxiety that's really hiding how well you actually do know the information so that you can have your tests finally be a more accurate representation of what you really know. It's this little technique that you can learn in less than an hour that I developed based on what I learned about cognitive behavioral therapy back when I was getting my master's degree in clinical psychology. Once you've got that tool to kind of deal with the immediate emotions of that acute test anxiety, then it's time to move on to the deeper cause of the second type of test anxiety. And that comes down to how you study. If your studying is disconnected from your results on your exams, it's because there's something wrong with the way you're studying. And it's important to point out it's not that it's something wrong with you. It's more likely something wrong with the system that never taught you the correct ways to study. So I train my VIP tutoring members on the 4 steps to go through the information so that you can accurately identify the most important information on your own, even if your instructor is not making it very clear for you, and then guide you through how to think through that information like a nurse so you can apply it to exams. Do those 2 things and you will take care of your test anxiety. You can get a free overview of my Silver Bullet study system in the link in my bio.